I'm Sarah Roberts, a doctor of public health and associate professor at UCSF's Advancing New Standards in Reproductive Health. Today, I'm going to talk about policies related to alcohol use during pregnancy in the United States. Since the 1970s, some states have had laws related to alcohol use during pregnancy. Today, most states have at least one alcohol and pregnancy policy. Despite the fact that some of these policies have been in effect for more than 40 years, there's not been any research about their impact. We wanted to know whether these policies have any effect on alcohol use during pregnancy, negative birth outcomes like low birth weight and preterm birth, or prenatal care use. To look at the impact of the policies, we conducted a legal epidemiology study with over 40 years of data. Our first question was, do state alcohol and pregnancy policies lead to reductions in alcohol use during pregnancy? The answer is maybe and only slightly. We found that most alcohol and pregnancy policies were not associated with alcohol use during pregnancy. Our second question was, do state alcohol and pregnancy policies lead to reductions in negative birth outcomes? The answer is no. They actually increase negative birth outcomes. We found that half of alcohol and pregnancy policies led to increases in low birth weight and preterm birth. The number of babies adversely affected by these policies is in the thousands per year. We estimated that in 2015, there were thousands of low birth weight or preterm birth babies because of some of these policies. Our third question was, do state alcohol and pregnancy policies lead to increases in prenatal care use? The answer is no. They actually decrease prenatal care. We found that 3 alcohol and pregnancy policies led to decreased prenatal care use, and only 1 led to increased prenatal care. At first glance, our findings might seem surprising, but these findings are consistent with previous research centering women's perspectives. Prior research finds that fear of having already harmed one's baby due to substance use earlier in pregnancy influences women's decisions about seeking prenatal care and beliefs about whether reducing or stopping use later in pregnancy will make a difference. This research also finds that fear of being reported to Child Protective Services, having one's baby removed from one's care, or being sent to jail leads women who use drugs to avoid prenatal care. At best, most alcohol and pregnancy policies do not affect use during pregnancy, prenatal care, or birth outcomes. At worst, some of these policies lead to increases in low birth weight and preterm birth and to decreases in prenatal care. There are 3 important implications from this research. First, do not assume that existing policies targeting alcohol use during pregnancy have the intended effects of reducing use during pregnancy or reducing negative birth outcomes. Second, harms from substance use during pregnancy come from substance use itself and from policies implemented in response. Third, states should be cautious about adopting policies from other states or expanding current policies to new substances, specifically to marijuana in the context of marijuana legalization. For more information on this research, please visit ANSIRH.org or email me at sarah.roberts@ucsf.edu. Thank you.